NYU has a lot of fascinating research as of late. Really, I think they are moving ahead in terms of thinking about how we can understand novel risk factors, how patients are doing, how they perceive disease, and we're really in the forefront with some really large randomized trials thinking about how best to treat patients. One large trial that is ongoing, which is not yet finished, is the ischemia trial. That is being led by Dr. Judy Hockman. A number of us here serve on a variety of different committees. We sort of help run the trial. It's really a fundamental trial because it will answer a very important question that a lot of practicing physicians have: how best to treat the patient who has at least moderate ischemia on a stress test. And patients are being randomized to either an invasive approach or a conservative approach, and regardless of what the results will be, it will clearly change practice for decades to come. So in patients who have an abnormal stress test, a dilemma comes about, which is, how should I best treat these patients? Should I bring them to the catheterization lab? And if you find an abnormality, should you be opening a blocked artery? Should you put in a stent? If there are multiple blockages, should you be doing bypass surgery? Many people go down that route. However, a lot of data to date does not suggest that that's the best thing. There is definitely a hypothesis out there that in the very abnormal stress tests, that may be beneficial, but that is not yet proven by any means, and that's really the fundamental question of the ischemia trial. So our goal is to collect a lot of specimens so that we can answer questions. Why does ischemic heart disease happen? Why do bad events occur to some of these patients? And really, NYU is playing a very large role in terms of making this trial work. There will be a study by myself and by Dr. Newman looking at the relationship between air pollution and particulate air matter, how that correlates with the prevalence of blockages in the carotid arteries. And so what we've shown is that in areas in this country where pollution is highest, there is a significantly higher risk of having carotid artery stenosis. You know, we are always trying to look for new risk factors. We're always trying to find why is someone at increased risk? We always think about traditional risk factors: smoking, cholesterol, high blood pressure. We don't really think too much about the environment around us. But what we've shown is that even at low levels of environmental air pollution, and in this study we use all types of air pollution. We use something called PM 2.5. This type of air pollution is caused from oil combustion, gas, ozone, coal. It's really a combination. And so what we've shown is that when you group all of these together, there's a clear association between levels of this air pollution and prevalence of blockages in your carotid arteries. We just submitted a grant to sort of get into the, very detailed understanding of which types of air pollution is most likely associated with different types of disease, not just in your carotid arteries, but also in your lower extremities. But we do believe that investigating this will really bring attention to an often neglected area. We have found that in a survey of physicians and house staff is that your education in terms of understanding what is a good diet to be on, what is proper nutrition, is really lacking. That healthcare professionals really do not get enough education in this area. And we've shown this in both attending physicians as well as in as well as in resident physicians and medical students. So really, we've uncovered an important gap in the medical education of today. We found that, medical students really do not get enough education in a very important area that can have profound health importance for their patient.